Another round of autism and vaccines claims. And I've been here before, right? I've debunked, I've provided the nuance. But the problem here is that this isn't from a random creator. This is from an official government website that's designed to protect our public health, and they're not. Here's the truth. There are no randomized trials where infants are intentionally not vaccinated so we can watch autism rates years later. That will never happen for ethical reasons. We would be putting babies at risk of infectious diseases we have protection for. And yes, much of the autism research has focused on MMR, which is given after age 1, not in the newborn infant window. Multiple studies have followed children who received routine infant vaccines, including DTaP, Hib, Hep B, polio, and Prevnar. These studies look at autism diagnosis rates, timing, number of vaccines, and total antigen exposure. And across millions of children in these data sets, the autism rates are the same no matter what schedule a child followed. We also have studies looking at ethyl mercury exposure from older thimerosal-containing vaccines and studies examining total vaccine antigens in the first year of life. None of them show an increased risk of autism. And we have research comparing on-time infants to under-vaccinated infants, and again, no difference in autism or other developmental outcomes. So the natural question becomes, do we need another big infant vaccine autism study? And here's the honest answer. Probably not. And ethically, it would be almost impossible to do. A randomized trial would require assigning some babies to skip vaccines we know prevent serious illness. No ethics board will approve that. Well, maybe the current CDC would. The alternative, enrolling large numbers of completely unvaccinated infants, isn't realistic either. Families who avoid vaccines are not lining up for clinical trials run by government or academic groups. And when the existing evidence already includes millions of children from multiple countries across many study designs, the chance that a new study suddenly reveals a hidden autism signal is extremely low. Funding another autism and infant vaccine study sounds responsible on paper, but in reality, it risks wasting resources on a question that has already been answered again and again. Meanwhile, real gaps in pediatric health like access, maternal mental health, early intervention for autistic children, environmental exposures, and prenatal care remain underfunded. So when statements imply that we will still need to look into infant vaccines and autism, they're not highlighting a scientific gap. They're contradicting decades of high-quality evidence and the clinical consensus we rely on every day. Autism diagnoses have gone up, infant vaccines have gone up, but lining up the two rising lines doesn't tell you anything about cause. Classic case of confusing correlation for causation. For the gazillionth time, here's what actually explains the change in autism numbers. Diagnostic criteria widened in the 1990s. Routine screening became common in pediatric offices. Schools required formal coding for kids to receive services. Many children once labeled with intellectual disability were reclassified under the autism spectrum. Parents and clinicians became more aware. Stigma dropped, so more families sought evaluation, and the global data doesn't match this vaccine theory. Some countries with fewer infant vaccines have higher autism rates, and some with more vaccines have lower rates. Autism shows up everywhere, but rates are highest in places with better access, screening, and awareness. That paper that they're referencing is what we call an ecological study. That means it looks at big groups, not real kids. It compares things like how much aluminum a whole country uses and how many autism diagnoses that country reports. It doesn't look at any individual child, their actual vaccine doses, their health history, or their genetics. These kind of studies can spark ideas, but they cannot show cause. When you only compare two lines on a chart, you can make almost anything look connected. When researchers study real children, not just country-level graphs, they don't find that aluminum-containing vaccines raise autism risk. They look at how aluminum moves through the body and show that the amounts in vaccines stay far below levels known to cause harm. And when you combine data from over 1 million children across many studies, you still don't see a link between vaccines, including aluminum-containing ones, and autism. Here's the nuance that this claim leaves out. The IOM reviewing early MMR studies and noting their limits isn't surprising. Every field has early papers that don't hold up over time. The part that gets ignored is their actual conclusion. MMR is not linked to autism. And calling the later research just retrospective is meant to make it sound weak, which is not true. In vaccine safety, retrospective studies are not a shortcut. They are actually the gold standard for real-world evidence. They let researchers look at huge populations across many years and see what actually happens in everyday clinical practice. These studies include hundreds of thousands of children, often across entire countries. They aren't little pilot projects. They're the reason we know whether something truly shows up in a population. And the consistent finding across these massive data sets from Denmark, from the US, from sibling studies, from long-term follow-up is the same. Kids who get MMR are not at higher risk of autism. So the issue here isn't that researchers relied on the wrong study design. It's that the people pushing this claim don't like the result. And instead of saying that, they try to discredit the methodology to reopen a door that the evidence has already closed. If there were a real autism signal, it would show up there. And across the biggest studies we have, including more than 650,000 children, you still don't see higher autism rates in kids who got MMR. Which leads me to the next claim. Here's the problem with this argument. Those studies are not comparing Denmark to the United States. They are comparing vaccinated, unvaccinated children inside Denmark, all on a similar schedule, living in the same environment. If vaccines were raising autism risk, you would see higher autism rates in the vaccinated group within the country, no matter what the local schedule looks like, and you don't. And this pattern repeats everywhere. In the US, we have sibling studies where one child can get vaccines and the other doesn't, and the autism rate is the same. So when someone tries to dismiss a well-designed study because it was done in another country, that's not real methodology criticism. It's a way to throw out strong evidence because it doesn't support the conclusion they want. High-quality research is high-quality research, and across countries, schedules, and study designs, the results keep lining up. There is not a higher risk of autism in vaccinated individuals. And if you don't see this, it's because the parents of unvaccinated kids are not seeking diagnosis for their kids' autism, and they're just walking around with their autistic selves. Asperger's syndrome has not been a separate diagnosis for more than a decade. Since the DSM-5 in 2013, it has been folded into autism spectrum disorder, and the criteria has been redefined. So when this official report on a government website is referencing this study and Asperger's as if it's a current separate label, that already raises questions about how well they understand and code autism. And frankly, I don't want people researching the cause of autism if they don't even understand autism. This update doesn't bring new science. It brings doubt. And when you place this language on a CDC page right before the ACIP meeting, it's hard not to notice the timing. Especially when at the very bottom of this CDC statement, they openly note that the line, "vaccines do not cause autism," only stayed up because of an agreement with Senator Cassidy. That tells you how much of this was driven by politics and not evidence. Cherry-picking weak studies, hinting at aluminum concerns that bigger studies don't support, and acting like long-settled science is suddenly up for debate, this is exactly how distrust gets seeded. And after watching this play out, I'll be honest, my trust in the CDC on communication is gone. I'm not sending parents to this page, and I'm not using it as a primary resource, which I haven't for a long time already. So I'll be linking more balanced, evidence-based resources below. And make sure to get my always free, newly updated vaccine guide, which goes over many of these concerns, because parents do not need confusion. They need clarity rooted in what the research and clinical knowledge actually shows.